And your head's going to go right here.
51-year-old Amy Schmalzy is a registered nurse at Yale New Haven Hospital.
The heat started coming, but then the sweat started coming, and they were getting more and more and more intense.
The cause of her distress is not an illness, but a natural process. Like many women in their late 40s or early 50s, Amy is going through menopause.
So what happens with women is the ovary just runs out of eggs.
When those eggs are lost, hand in hand with that, we lose the ability to produce estrogen. Multiple organs in the body require estrogen for optimal function. It includes the brain, it includes the bone, and without the estrogen, there are definitely some consequences.
Consequences like weaker bones, sexual dysfunction, mood swings, and the dreaded hot flash.
With the hot flash, there's a surge of adrenaline, a release of adrenaline, and that can cause heart racing, palpitations, sweating, anxiety. These can be very disruptive, disturbing symptoms.
It was horrible. It was embarrassing because I thought people were looking at me and could see what I was feeling.
Most women will experience hot flashes or vasomotor symptoms at the time of menopause, and for about 2/3 of them, these are very severe, enough that they can significantly disrupt their lives.
Because declining estrogen is to blame, doctors say replacing the estrogen can often eliminate hot flashes.
Hi, how are you? Good. We're using much lower doses of estrogen or hormone therapy than we used to, and that may not work for 100%, but almost everyone, nearly 100%, can get relief with the right dose of estrogen.
But hormone therapy is not without risks. One form has been linked to breast cancer.
The real risk of breast cancer seems to be the combination estrogen plus progestin. Even then, that risk is very low. Within the margin of error of the study, less than 1 per 1,000 increased risk.
The landmark government study, called the Women's Health Initiative, also found that hormone therapy raises the risk of heart disease, but only when taken by women in their 60s or 70s. Women who start hormone therapy in their 50s appear to get more benefits with fewer risks.
It may be a reasonable choice to use hormone therapy if you're fairly close to the menopause and you want to use it for a short period of time for the relief of symptoms.
Amy Schmalzy has been on hormone therapy for about 3 years now.
And no more hot flashes. I haven't had one since.
If you're giving it for hot flushes, 80% of hot flushes are over in 3 years. So you probably figure you'll do 3 years and then you'll gradually withdraw it so that you can down-regulate her estrogen receptors.
For you, the risks are...
While the debate over hormone therapy continues, most experts agree on one point. Every woman should discuss her individual risks and benefits with her doctor.
I will see you next year when you come for your next annual visit.